Good day, and welcome to the Anxiety and Despair Addressed. I'm always worried my cancer will come back. Today's conference is being recorded. At this time, I'd like to turn the conference over to Jennifer Gillette. Please go ahead, ma'am.
Thank you so much, Cassie. Yes, my name is Jennifer Gillette, and I'm the staff social worker at the National Bone Marrow Transplant Link. I'd like to welcome you to our Lunch and Learn with the Link. This month's program will focus on coping with the fear and the worry of recurrence. A special thank you to the Leukemia and Lymphoma Society, Jazz Pharmaceuticals, Insight Corporation, Pharmacyclics, and Janssen, and our esteemed Link partners for making this program possible today. Just so everyone is aware how our outline will go, I'm just going to give you a couple minutes about what the Link does, just in case you're not familiar with our organization. And then we have our professional speaker, Dawn Speckhart, who will be speaking to us from a professional standpoint on coping with the fear of recurrence. And then survivor, Juanita McReynolds, who will be joining us from a survivor perspective on coping. And then we're going to open up floor for questions. For those who may not be familiar with the Link, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We provide resources, support, and education. Some of the resources we provide to help families navigate their transplant journey are webinars, podcasts, blogs, lunch and learn calls like the one you're on today on topics such as chronic graft versus host disease, disease-specific information, caregiving, coping, treatment options, survivorship, and more. We also have a wonderful peer support mentor program if anyone's interested in talking to someone else who has been through this journey, and that's also available to caregivers and donors. We have our second birthday recognition program, our books, referrals, and we provide emotional support from a licensed social worker. Please feel free to reach out if you're interested in any of those services. Before we begin today's program, I'd also like to review a few housekeeping items. First, let's be mindful of how long our questions are during the question and answer portion, knowing that other people might like to get in a question. Also know that the information provided in this program is meant to stimulate conversation with you and your own healthcare provider and is not meant to replace your individualized medical plan. So now on to the education program. We are so thankful to have our first speaker with us here today, Dawn Speckhart. Dawn has been a clinical health psychologist at the Bone Marrow Transplant Leukemia Program at Northside Hospital in Georgia since 2002. She graduated from Indiana University with a PhD in psychology in 1999 and has worked as a psychologist in oncology since 1990. She has presented research on the impact of psychosocial factors on bone marrow transplant, survivors at ASH, Tandem Conference, and the American Psychological Oncology Society Conference. Thank you, Dawn, for being with us today.
Thank you. Thank you for that introduction. So yes, I'm Dawn Speckhart, and again, I am the psychologist for the blood and marrow transplant program at Northside Hospital here in Atlanta, Georgia. And so for almost 20 years now, I've been working solely with bone marrow transplant patients, acute leukemia patients, and high-risk lymphoma patients. Today, I'm going to discuss ways for managing the fear of cancer recurrence. Most importantly, and first off, the fear of cancer recurrence is normal. With oncologists being unable to tell their patients that treatments are 100% effective, there is always a fear that cancer will come back. For certain cancers, it is more than others, but as we all know, it is normal to worry about the fear of cancer recurrence. Research shows that about 50 to 70% of survivors have a moderate to significant fear of their cancer coming back. Some anxiety about cancer recurrence is helpful as it gets patients to attend their follow-up appointments. So, for example, a normal bruise from bumping into somebody can spark a fear and a desire to get their labs checked. We have a 24-year-old male who's about 3 years out of treatment, and he normally does not comply with his follow-up, so he skips them because he's too busy or doesn't feel like coming in. But recently he went to a concert, he was dancing in a large crowd, he got a bruise on his arm, which of course gave him a little bit of fear because he saw some bruising and did come in for his next follow-up, got his labs checked, and we were very grateful that he came in. However, too much anxiety about cancer coming back can be bad. Too much of a focus on this worry of the cancer coming back can hinder survivorship, and it would decrease quality of life. Some people are so worried that they lose the enjoyment in their life today. We had a 50-year-old woman, a patient, who completed transplant and was cleared to reenter life and start engaging in family activities. She was so focused on a fear of relapse and her cancer coming back that she was unable to switch her thoughts and plans for engaging with her family. Therefore, she did not go with her daughter, who was moving into college, to decorate her dorm and move her in. Once we worked with her and she felt better, she was so sad that she had missed this opportunity and time with her daughter. So, there are several tips for managing this fear of the cancer coming back. The first is to figure out what triggers this fear. For some people, it is a symptom like a headache or a cough that they experienced when they were first diagnosed. For some, it is simply going to a follow-up appointment, awaiting a scan result, or a lab result. It can also be triggered by seeing an advertisement on television or a celebrity being diagnosed with cancer on TV. In our office, we have consult rooms, just 3 of them, where we meet with families to discuss different things. Some of our patients cannot return to the same consult room where they were initially diagnosed and received bad news because they have flashbacks, like post-traumatic stress disorder, where just sitting in that room makes them anxious. So we have to place them in different conference rooms when we meet with them for follow-up appointments. We have another 60-year-old patient who, when he was initially diagnosed, had a sinus infection that brought him in. And so every time he sneezes or has a headache or has sinus symptoms, he gets nervous and feels like this means his cancer is coming back. It's important to educate yourselves on what cancer recurrence is. No 2 people are exactly alike. It's important to ask your doctor what your risk of cancer recurrence is. What kinds of symptoms would you need to worry about or look for? Or is there any way that you can lower the risk of your cancer coming back? In 20 years, I can say that no 2 patients act the same. They may be similar, but everybody's journey is different. And on most occasions, there is nothing to do to lower the risk of your cancer coming back. For some, there might be compliance with a medication that might help. But you need to specifically ask your doctor what you can look for or what you can do that might help. If the answer is that you've completed your treatment and now there is nothing more to do, that is hard to accept, but something you have to live with. And trust me, I know that lacking control is one of the hardest parts of having cancer. Lacking control remains one of the hardest parts of being a cancer survivor. But most of us really don't have the control we perceive in our lives anyway. It's more of a perception. So as you feel fears of relapse increasing, it's important to have a plan. With most people, the fears increase during restaging appointments. This time between getting a scan or a lab drawn and meeting with your doctor feels like forever. These are scheduled events, and it's important to stay distracted and stay busy during these times. Plan to bring someone with you who will talk nonstop about their children or anything other than being sick. Or go alone, perhaps, because maybe when people talk to you, it upsets you more and distracts you and makes it unable for you to think positive thoughts that you might be able to do if you were alone. Know that this feeling of fear will pass and that you might just have to accept it will remain until you get that meeting with your doctor and get that clean bill of health. So we have one patient who loves to bring a girlfriend with her versus a family member. They talk about the kids, they complain about their schedules, but their entire discussion that day avoids the topic of cancer. Other people bring that spouse or that parent or that friend that will just sit there silently with them in the office. They talk when needed, but they're really just there to be present. We are all different people, and what works for us differs. But most of us value support during restaging testing days or when receiving results. You just have to figure out what might work best for you. As you are feeling some fear of the cancer coming back, even between follow-ups, You need to talk about it. Share it with your family and friends. They want to be there for you as you would want to be there for them. Allow them to hear your fears, problem solve with them. We sometimes spend too much energy trying to protect our loved ones instead of working together with them to try to lessen everyone's fears. If you don't have family or cannot lean on them for whatever reason, there are many online or in-person support groups available. There are also programs like Jennifer mentioned with the link that connect you patient to patient to find support in whatever area you need to discuss. There is always someone that you can talk to about the fear of cancer coming back. It is a common theme that occurs across all cancers, all genders, and all ages. When we talk about bottling up our emotions and not talking about them, it's like pushing the door to a closet closed. Once it is overfilled, eventually the door bursts open and everything comes spilling out. You want to manage your feelings and deal with them as they come versus having them burst out when you didn't want them to. That is going to decrease your feelings of control and only increase your anxiety. In addition to talking about your fears, it's helpful to name what your fears actually are. You are afraid of your cancer coming back, but what else comes along with that? Are you afraid of having to go through treatment again? Are you afraid of losing your job? Are you afraid of dying? Are you afraid of asking your family to deal with this again? Organizing your thoughts will be helpful. When people are first diagnosed with cancer, we tell them to organize their lives so that personal things are set up the way they want them to be. We suggest this not to be negative, but just to decrease stress and worry in areas that we have some control in. If you haven't already done your finances, your long-term planning, finish that and know that there is one less thing that you need to worry about. But regardless of what we figure out, we know that people are going to worry about cancer recurrence. It is normal and it is common. So what can we do when that hits and we are having trouble coping? Everyone has tried different things over the years. Some have denied needing any help with the fear of cancer coming back, but there are proven coping strategies that have been shown to be effective for survivors worrying about cancer recurrence. The first thing is cognitive behavioral therapy. For people who believe in seeing a psychologist or a mental health professional, cognitive behavioral techniques have proven to be very effective. Cognitive behavioral therapy focuses on how our thoughts, beliefs, and attitudes can affect our feelings and behavior. Traditional cognitive behavioral therapy usually requires 30 to 60-minute sessions over a month or so, if not 3 to 4 months, usually including 4 different steps. First, identifying troubling situations in your life. Then, becoming aware of your thoughts, emotions, and beliefs about this situation or problem. Next, identifying the negative or inaccurate thinking related to this situation. And then, lastly, reshaping these negative or inaccurate thoughts to more positive or accurate thinking. So, for example, my gentleman who gets headaches, which was part of the first symptom he had when he was diagnosed, whenever he gets a headache, his initial thought is my cancer is coming back. With cognitive behavioral therapy, he can reframe his inaccurate thoughts and think about things more clearly, such as a headache can be caused by stress or sinus infections or allergies or lack of sleep. So instead of increasing his anxiety immediately, he can stop the negative thoughts and change to more accurate thinking. But not everyone has the means or the times to go see a mental health provider. Other options are meditation techniques like yoga. Yoga postures can help the physical and ease the physical discomfort that is caused by anxiety. It can stretch or balance the muscles. The overall practice of yoga can elicit the relaxation response, allowing both the body and mind to gain a sense of calm and ease. Mindfulness meditation can also be effective. It can slow down racing thoughts, let go of negativity, and calm the mind and body. Relaxation techniques like deep breathing or guided imagery can also be helpful. Guided imagery is a relaxation technique that uses positive mental images to influence how you feel. It is an ancient practice that includes simple visualization. It is a safe and simple technique. You need a comfortable place to sit or lie down. Then you take some deep breaths to relax. And then you picture a setting that is calm and peaceful for you. And then you imagine your scene and try to add some more detail. Deep breathing is another relaxation technique that can also be helpful. It doesn't require the imagination as much. Deep breathing is focused and slow. It is a technique used to send a message to your brain to calm down. It has been shown to decrease heart rate, decrease or stabilize blood pressure, and decrease stress. Unlike cognitive behavioral therapy, which is harder to learn online or from YouTube, meditation, yoga, guided imagery, and deep breathing can be viewed online, and skills can improve with practice. They can also be taught more effectively and more quickly with a professional or mental health provider if that option exists. And lastly, it's really important to focus on the present. Focus on the same skills that helped you manage getting through your treatment when you were first diagnosed and first receiving treatment. Positive strategies such as exercise, nutrition, prayer, and staying distracted really help. Distraction is a wonderful tool to help you get through short periods of anxiety. When first diagnosed, patients focus on diet and exercise, going for a walk, whatever they needed to do to get through their first month, their first 3 months, their first 3 weeks, or each individual day. In survivorship, we lose that focus on the here and now. We spend too much time worrying about an event in the future that we miss the importance of today. Like my 50-year-old parent who missed moving her daughter to college because she was too worried about other things, go back to what you know and go back to what worked for you. Exercise, prayer, focus on the positive. When you were getting your chemotherapy, you got through each hour, each day, each week. And that same thing helps when you're dealing with anxiety. If you take the focus back to today and right now, your quality of life will improve. In the end, you have to remember to be patient with yourself. Fear of cancer recurrence is common and a normal part of survivorship. Too often, survivors beat up on themselves because they want to be better or they want to be what we call normal. Worrying about cancer coming back is normal. So therefore, you should plan for it, recognize it, and figure out what strategies work best for you. If the fear of cancer coming back simply happens when you're going in for your restaging, you're one of the lucky ones. But even during those shorter periods of time, don't struggle through it. Make a plan, learn skills, and make each day as good as it can be. The fear of cancer recurrence does tend to decrease as time passes from your diagnosis and the end of your intense treatment. So that is good news. However, some patients tell me that even 10 years later, there might be one trigger that still hits them the wrong way. You're not alone. All survivors deal with the fear of their cancer coming back to some extent. You just need to deal with it effectively so that you can maximize your quality of life. And that's all.
Oh, thank you, Dawn. That was a great presentation, and we really appreciate you helping us with this because we know this is hard on a lot of people. And our next speaker that is joining us is Juanita McReynolds. She is a woman we hold dear here at the LINK. Juanita is an AML survivor after receiving a transplant back in 1996. Since that time, she has been a core volunteer at the LINK, speaking to several people that need support and guidance, helping around the office, and being there to inspire anyone that needs it with her absolutely remarkable faith and can-do spirit. She is a survivor in every sense of the word. I was not sure whether I was going to share this or not today, but I wanted to let everyone know how important it is for her to be here for you today. Juanita lost her husband on Monday to COVID-19, and she still is choosing to be here today. because it means so much to her to try to offer people hope. And we are just so honored to have her be a part of this call and are so thankful for her being here. And Juanita, we are just all with you and want to support you, and we lift you in our thoughts and prayers. But we thank you for being here to help other people that are dealing with this fear of recurrence.
Thank you. I thank you for that beautiful introduction. And can you hear me, everybody, fine?
We can hear you.
Okay. And I appreciate it. It warms my heart to be a part of this. And as Jennifer said, I am a cancer survivor, almost 25 years. And I had my bone marrow transplant in January of 1996, and it was followed by a very lengthy stay. My home recovery lasted for several months, and my return to what I call my new normal involved experiencing graft versus host disease, some severe stomach and digestive problems. I had developed diabetes due to the high-dose steroids. I had shingles, fatigue, anything they had on the list of side effects, it kind of hit me. And I tried as best I could to stay positive, but the experience was something else. I had various infections, was sometimes depressed. Sometimes I felt helpless. Never hopeless, though, but I did feel helpless. I had lost control of everything in my life, and I was one of those people who took charge of things and was proud to be in control, but I had to let that go. There were times I was lonely because I had to limit my guests because of my compromised immune system. And then I had those fears of additional infections and fear of the unknown. I experienced and had to cope with other anxiety-related issues. And one of the things with this COVID-19, it reminded me of how frightened I was of fear of infections because of my immune system. I was frightened to receive visitors while I was in the hospital and after returning home because I didn't want to be sickened again. And I limited visitors because there were people that I just didn't want to get a cold from or whatever. I avoided crowds. I avoided close contact with people, friends and family. I tried to wear masks in public places. And it just is ironic that is exactly what we're going through. Not only am I limiting visitors, at this special time in my life, I can have no visitors. And it's just a different time. But, you know, then and even now, I comforted myself by thinking, so I'm missing events, we're missing family gatherings, there are people that I can't be with, but then there's a lifetime of events and times where we can be together, and I just have to hold on to that as I held on to that almost 25 years ago. So it is affecting us all now. And then, as Dawn talked about, I had the fear of reoccurrence or secondary cancers. I had to be convinced by my oncologist that we didn't go through the journey we went through for me not to make it, especially if I did my part. And my part was to be diligent in trying to prevent other cancers like breast cancer, cervical cancer, colon cancer, and it was especially important to me as members of my family had succumbed to some of those various cancers. I must admit to becoming alarmed when having unusual bone pain in my leg. I noticed certain skin irregularities or that I felt I had a lump in my breast. My first thoughts went to all those cancers. So I had to have those things checked out. It turns out a change in cholesterol medicine eliminated the leg pain, that my skin problem was just age-related. And after a non-routine mammogram, I remembered that my bruised breast was the result of a box that fell off a shelf and hit me. But I know I will never stop having things checked out. I just don't panic like I did anymore. I experienced insomnia, the fear of death. For a brief period, I needed sleeping aids. I had some reoccurring, very disturbing dreams. And I found that music, relaxation recordings, as well as my religious influence had a lot to do with keeping my anxiety level down. I was reminded that my diagnosis was made very timely. My matched sibling donor was a miracle in itself. I only had 2 siblings, and one of them was a perfect match. And that God hadn't set things in place for me not to have a successful transplant. I experienced survivor's guilt when learning of others who hadn't survived their transplants, and sometimes even other cancers. I would feel guilty. Even 10 years later, when my donor brother passed away from cancer, I became somewhat depressed. I had to remember how happy he was to save my life, and that I had to honor his life and his gift. There were visits to a psychologist early on, and that person helped me work through some of my anxiety. I had peer support early on that was very instrumental in calming some of my fears. Before all the internet support, I found it to be therapeutic to attend a local monthly support meeting. And talking to other transplant patients and their family members was quite helpful. It was comforting to know that others were feeling the very same emotions I was. It was also encouraging to see those who had survived and were living normal lives after their transplant. I used to visit transplant patients, and I found great joy in sharing my story. It seems that as if I found a purpose in going through and surviving such a journey. And I would do it again. All this change with the coronavirus things where people can't visit people and that they're alone. But we certainly can make phone calls, and now all the people with the Skype and all those other abilities that I didn't have could take advantage of those. The visits also reminded me how fortunate I was to survive, which makes me just want to help others even more. It took a number of years, as well as major blood work, that showed that there was no evidence of me ever having cancer, for me to even relax and be convinced that I was completely cured. I don't ignore the abnormalities when they occur, and I see my primary physician on a regular basis, and I live a normal and complete life. And I have no lasting effects of cancer, except that I handle life situations differently. I appreciate my life and that of others more, and I try to make a difference wherever I can, and I hope I'm doing that even in this time. So thank you for allowing me to participate. I'm done.
Juanita, we adore you, and we thank you so much for being here today. And we just, I can't say it enough. We adore you.
I thank you.
Okay. I think we've gotten some great tips, but I'm imagining there might be some people out there that have some questions. So, Kathy, could you tell our callers how to do that, please?
Absolutely. At this time, we will open the floor for questions. If you would like to ask a question, please press the star key followed by the 1 key. That was star 1 to ask an audio question. First questioner, your line is live.
Hello?
Hello.
Yes, I have a question. I want to first thank you. And thank you, the survivor. My heart goes out to her. I'm an 8-month survivor of a stem cell, and I had a very similar experience with my sister being a perfect donor and everything going well. But if you could just say a few words about now with the COVID-19. I've been isolating myself for nearly a year now, and now I know I'm going to have to isolate myself some more for the until we get a vaccine for COVID-19. But just some ways to deal with that and the fear of recurrence, and that you really can't get treatment because you can't go out if a recurrence occurs.
Yeah, I mean, I'm just going to speak for our center. I mean, you should still be following up with your physicians as they.
I am. We do telephone.
Yeah. I mean, I think, kind of like what I was discussing, any of those techniques that work for you, and of course everybody varies, and, I honestly can't do guided imagery for myself, but I have a lot of patients who love it. So in figuring out what works for you and knowing that right now you are part of the normal population and that we are all indoors. And so you are experiencing the same anxiety that everybody is. There hopefully is some comfort. I usually say to people when they have an appendicitis and they're 3 years post-transplant, that's a normal person's problem. So what you're having right now are normal people's problems. So that part's good. The fear of what if it comes back and I can't get treatment, you can. You absolutely can get treatment. Cancer patients are still getting treated during this time if they need to. So I don't want you to panic that if that were to happen, there's not access to health care. It's just, I know, scary for everyone. We're all inside and all waiting for this to pass.
Thank you so much.
Thank you.
As a reminder, if you would like to ask a question, please press the star key followed by the 1 key. That was star 1. Next participant, your line is live.
Hello, my name is Deborah, and I want to thank the presenters for their part. I want to go back to the question about that place of lack of control. I am scheduled to have my transplant in about 6 weeks, so I'm not yet a survivor. I hope to be. And I guess I'm just anxious about what to happen. I'm one of those people that like to know things, and I've been reading and talking to some survivors, but there's a lot of anxiety around the unknown. Can anyone speak to that?
Can I say something on that?
Please, go ahead.
This is Juanita. I know exactly what you're talking about. When I did all my research and tried to ask all the questions and everything to be as prepared as I could be, I realized as I was going through, it was early on, it was new pretty much. At the facility I was at, I was only the fourth transplant patient they had. And there were sometimes I would get frustrated, because things were happening that I would ask them, well, didn't you know that was going to happen? Did you see that? And I realized that it was all new to everyone, and every patient was different. And I had to be the person to say, I have this little scar, or I have this little. What was happening is my skin was peeling, and I didn't know. One time I was wiping, and I was like, gee, I'm very dirty. And then when I told them, they said, no, you're having a skin infection. And then something else happened, and I said, you didn't know that? And they said, no, it does not happen to everyone. But what we will do is respond every time something happens, we'll respond, and that was what it was. And I had to realize that I had to advocate for myself. They were there for me, but if I felt I had a headache, they didn't know I had a headache unless I said it. If I experienced anything, for example, they didn't tell me, and they thought they did, that I would probably develop shingles. So one day after being at home, I had a sore in my mouth, on my lip, and my nose, and when I called, they told me to come in, and they took a culture, and it was shingles. I didn't know I was going to get shingles. I didn't know how shingles appeared, and they didn't know I was going to get shingles. So all I'm saying is that we won't be able to control everything, but as things happen, we report them or they notice them. But even if they don't notice them, that we make sure that we're on it and allow them to help us, if that makes sense.
I appreciate that. Thank you.
Can I also say something, I think, too, which that was wonderful, Juanita, because you have a perspective that I do not have. So that is wonderful. But control is something that we all want. I want it today, and I don't have cancer. I think just like she's saying, you have control over certain things. So if something happens, you have the control to share it with the providers. You have control over what you eat today. You have control over taking your medications on time, which I'm sure they told you are very important. So what you can start to think about is not the things you don't have control over, but the things you do have control over. So just like she's saying, you do have control of making your medical providers aware of the situation. You do have control over, in general, your environment at home, making sure you have your caregiver present, all of the things that your transplant program has told you to do. The unfortunate part, which is clearer for you right now, is that you don't know what's going to happen. But honestly, I don't know what's going to happen for me tomorrow either. And even though my journey with my children and my husband should be similar to other people's, it's not. It's very different. And so your transplant journey, which might be similar to other people's, might also be very different. So when you're done, just like her, you will look back and you will have such a valuable experience that you can share with other people. But it really, like most things in our life, doesn't make sense until we're looking back. But I would accept, in this strange phrase that everybody hates, but accept that you don't have control. You cannot predict the future, and really try to focus on the things you can control, which is hokey, I know, and not something I would want somebody to tell me, but that's really what it is. You gain your control with the things that you can.
You know, Don, it's like a surrender. It's a surrender, yeah. And know that you can't do all things.
Yes, it is. It's a serenity prayer. I hate to say it, but that's...
No, I said surrender. Yes. That you have to surrender those things that you cannot control and be satisfied with the things you can control and do what you can.
Correct. I agree with you.
And as a reminder, if you'd like to ask a question, please press the star key followed by the 1 key. That was star 1. At this time, we have no further questions in queue.
Okay. Well, we know that sometimes people might get questions after the fact, or perhaps anything else that you want to follow up with us on. So you are welcome to reach out to myself at the link. I'm Jennifer Gillette, and my email is Jennifer Gillette, which is GILLETTE at nbmtLINK.org. You can also go back to your registration information and reach out to us. But I want to thank both of you for being with us today. This is certainly a challenging time for many people, and we just know how important it is to get support. And we know that cancer doesn't go away just because COVID's going on. And so if you need extra support, please feel free to reach out to us. And again, I thank our LINK partners and our sponsors and our wonderful speakers. And again, Juanita, you are in our thoughts and prayers. And as well as all of you going through a cancer journey at this time, and those of you that might be a little extra nervous because of certain treatments, we certainly care and are here to help. So everyone have a great day, and we will catch you next time, hopefully at our next Lunch and Learn in May. And more information will be coming out on that soon.